look at this nutrition label. This is from an ice cream container. How many calories would you consume if you ate the entire container? 1,000. Very good. That one was quick. Some of you have eaten an entire container of ice cream. And this is simple, right? You just multiply 4 times 250, you get to 1,000. Very simple math. So let me share with you that this is certainly a nutrition label, but it is also part of a survey that we use to assess health literacy and numeracy. We give this survey and we give this nutrition label to our patients, and we ask them 4 or 5 questions. And one of them is the question that I just asked you. In about 10 to 15% of cases, people cry. I mean, they literally look at this question. We ask them, how many calories would you consume if you ate the entire container? They stop and they cry. And I'm not exaggerating. The first time I saw it, I couldn't believe it. My research assistants came back and they said, she just cried at this question. And I was there for the next one and I saw someone cry. Men stop, they look at the question, they look at the label, and they just don't respond. These simple tasks are so emotionally charged because people have had difficulty in the education system. They've had difficulty with this kinds of mathematics, just navigating their lives. And for many people just aren't tested in their everyday life. They've built up these unbelievable ways of coping with dealing with situations like these. But you put this right in front of someone and you say, can you do this math? They can't. It's a very emotional situation. And by the way, you can't do weight loss unless you can do this math. Certainly not with the gold standard approaches. And so what we've been doing is trying to use digital health to overcome barriers like these. Again, this is just one example of why these approaches don't work, but I think it's a good one because it shows you that we can use digital health to overcome some of these literacy and numeracy barriers.